So good morning, everyone. Thank you for coming back and joining us for day 2 of the Fanshawe Care series. Today, we are going to be learning about your Morcare benefits. So I'm going to turn it over to our Morcare staff that's here to help walk you through what that looks like. Thank you.
Amazing. Thank you, Crystal. Hello, everyone. Good morning and welcome to the session. As mentioned, my name is Heyman. I am here from Morcare and I'm here to provide you all the information on your health insurance plan. Starting with today's session, it will be a lot of information that I'll be sharing with you today, but I absolutely do not want you to memorize everything. This is just for your understanding and for you to know that you can look for information whenever you need it. So I'll be taking you through our website. This way, it will be easier for you to go back and refer to whenever you're looking for a particular piece of information. So it will be me talking for 10-15 minutes, and then we'll be taking up questions towards the end. So I want to request everyone to hold on to your questions. Most of the time, a lot of questions answered within the presentation. So if you can wait towards the end of the presentation, that's when we'll be taking up questions. So I'll be presenting my screen for that. Just a sec. I hope you're able to see my screen. So this is the website, which is morcare.ca. Sorry, my apologies. Yes, the website morcare.ca, the link to that, I'll be putting it in the chat towards the end. You select your school Fanshawe, and this is where you land. This is the landing page. There's a lot of information here. The one that we'll start with first is your coverage details, which are right here. When you click here, which is International OHIP Alternative. Now, a lot of you may or may not be familiarized with the term OHIP Alternative. OHIP stands for an Ontario Health Insurance Plan, which you as international students are not eligible for as of now. So we, along with Fanshawe, have International OHIP Alternative for you, which covers your doctor's visits, x-rays, blood reports, etc. So this is your primary coverage that you have. You have $1 million lifetime benefit maximum covered under it. So if you scroll down here, you see it covers certain your hospital charges, your medical devices and services, etc. Along with that, there are certain maximums which are covered under it. You have $25,000 maximum for your maternity expenses, $50,000 for psychiatric hospitalization, $25,000 for oncology treatment, $15,000 for repatriation, and $10,000 for return home. Sorry, right here. Now, it is important for me to tell you that return home is not that, oh, I miss my family, I want to go back home, but it has absolutely to do and everything to do with your medical condition. If unfortunately you happen to do really unwell and the only way for you is to go back home, we have $10,000 benefit coverage under return home for that. As we scroll down here, you see there are certain exclusions which are mentioned here. I would request you to go through these exclusions so you have a clear understanding of what is covered under the plan and what is not. Scrolling down, we have prescription drugs. Now, prescription drugs are all the drugs that are that are prescribed by a doctor. So you have 80% reimbursement and with $5,000 maximum per student year for your prescription drugs, which covers your preventative vaccines and immunizations. So you have $150, which includes your hepatitis A and B, and contraceptives are covered at $200. Moving on, we have dental. So under dental, you have $750 maximum per student year with certain maximums, with certain services that are covered under it, which includes your basic and periodontic services. We have, as I scroll down, preventative services, major and endodontic services. Basic and periodontic services are covered at 80% reimbursements, which includes your simple extractions, anesthesias, fillings, root plannings, etc. Then preventative services are covered at 80% again, which includes your cleanings, periodontal scalings. Major and endodontic services are covered at 50% reimbursement. Now, I know these terms can be confusing at times, so I always recommend to the students to get a quote from the doctor well in advance so you understand how much is covered for you and how much do you owe out of pocket. So when we say 80% reimbursements, and let's say your total comes out to be $100, so 80% means $80 would be covered by us and $20 you'll have to pay out of pocket. For all the services, dental in total is covered at $750 maximum. Moving on, we have extended health. So under extended health, we have 100% reimbursement with certain maximums. It covers your paramedical practitioners, which includes your acupuncturist, audiologist, chiropractors, osteopath, podiatrist, naturopath, speech therapist. So all of these practitioners are covered at $500 each per student year. RMT and orthotherapy is also covered at $500 combined maximum. Now, this is a combined maximum. The above ones for per practitioner, you have $500 per practitioner, but this one is a combined maximum per student year, which covers your RMT and orthotherapy. Scrolling down, we have physiotherapy and physical rehabilitation, again, for a combined maximum of $500. Psychologists, social worker, and psychoanalysts are covered at $1,000 combined maximum. Now we have emergency taxi for $50. Now emergency taxi does not mean, oh, I'm getting late for exam, I should use the emergency taxi. No, it has absolutely to do with your medical condition. So in case you do not find any other mode of transportation to reach to the nearby hospital or clinic, you can avail emergency taxi for $50 maximum. Accidental dental is also covered at $2,000 maximum per student year. And extended health, it also covers your medical services and certain devices, which includes your diabetic supplies, fractures and dislocations, medical appliances, prosthetic appliances, home care, etc. It comes with certain maximums, which are always mentioned here. Scrolling down, we have vision. Now, vision, in contrast to the rest of the plan, vision is available to you for 24 months, that is for 2 years. Let's say you get your eye exam tested today, which is 29 July 2025. You'll not be eligible to get your eye tested before 29 July 2027. So in contrast to the rest of the plan, this is available to you for 24 months. You can have one general eye exam, which is covered at $80 benefit. Again, as I mentioned, for 24 months. As we scroll down, eyeglasses and contacts are available to you for $150 for 24 months. Moving on, we have accident benefits. Not a very fun topic for sure, but definitely an important one. It is very important for you and your loved ones to know that you do have this as a part of your coverage. Under accident benefits, you get $1 million maximum, which is applicable to any one accident with support available 24 hours a day. Now, under this, again, we have certain maximums, which includes your medical reimbursement, accidental medical reimbursement, $10,000, cosmetic disfigurement, $25,000, daycare, $5,000, family transportation, identification, etc. So all of these are part of your accident benefits. Now, I would again request you to go through these exclusions, which are mentioned here. It gives you a clear understanding of what all will be covered under your coverage and what all will not. Moving on, we have travel. Now, with travel, you have $5 million lifetime maximum, which covers a trip duration of 180 days maximum. Again, I would like to mention it is available to you for a trip duration of 180 days maximum, which the emergency out of coverage is provided to you by AIG. These are the given contact details that you can reach out to in case you find yourself in a situation where you need assistance. So you can always reach out to these numbers and they'll be able to help you. It comes with exclusions, which says accident travel benefits will not be covered for you in your home country or in Ontario, where you have your OHIP alternative, and it is only covered for a trip duration of 180 days maximum. Moving on, we have a wonderful student wellness program. So the student wellness program was designed to help provide you a healthy balance in your mental and physical well-being. Student life can be difficult at times. You might feel okay today, but tomorrow, if you find yourself where you are looking for mental or physical assistance and you need help, this program is wonderful, which comes with different resources, coaching, tips, and tools. So if you scroll down here, how you can access is you can access it through the app, which is the Dialogue app, or you can reach out to this phone number, or you can also use the given website. Now, the services that are included under it are access is available for 24/7 for any phone or virtual resources worldwide. You have career development, time management, student life balance, personal growth and development, dependent care, legal and financial support, daily living, mindful and wellness coaching. So all of these services are available to you under the wonderful student wellness program. Next, we have enhanced coverage. Last but not the least, the only thing that I need to cover is the early arrival, which means if you happen to arrive 30 days prior to the effective date or prior to the start of your coverage, you are still eligible to reimburse for any doctor's visits, hospitals, and your any primary coverage. So you can just hold on to your receipts and you can submit your reimbursement for that. So this is available to you 30 days prior to the effective date. Again, some exceptions are included, so you can always go through these to get the understanding. Okay, so this is everything that is there in your coverage. There's one more section that I need to take you through is your space section. As we click on the your space section, this is where we land. Now, if you see here, we have certain booklets and forms available for you. Now, the only booklet that you need to see is your 2024-25 International Student Insurance Booklet. This is a very extended version of what I have taken you through right now. Soon, starting September, we'll be having the 2025-26 booklet as well. So you can refer to it if you're looking for a detailed information on a particular piece of information for your coverage. Now you see here we have certain forms. We have the international health claim form. We have the dependent opt-in form. The form that you'll need the most is your health claim form, which you'll be requiring to file your claims and for your reimbursements and everything. So as I said, starting with September, if you're a September start students, we'll be having the new 2025-26 form available to you on the website right here. So you can use the form. All you need to do is fill in your details, provide the reasons and diagnosis, attach your original receipts with it, provide us your bank details, and you'll be able to submit your claims. Then if you see here, we have the dependent opt-in application in case you want to opt in your family. When I say family, it includes your spouse and kids. So if you want your spouse and kids to have the same coverage as you and the same duration as you, you can use the dependent opt-in form and submit it. You can also do it online. I'll show you towards the end. It is also available. The tab will be available to you on the website as well. Now, if you scroll down, you see a student medical card. The student medical card is the card that you'll be using when you go see a doctor. It is available to you for direct billing and for your coverage information. All you need to do is include your put your date of birth here, your student number, and you'll be able to generate your card. At times, during the start of the semester, we're still receiving enrollment files and you may not be able to access your student medical card, but you don't have to worry, you're still covered. Even if you have to go see a doctor, you can always keep the receipts and file through reimbursement, but you'll be able to generate your card within a few weeks of start of your coverage. Scrolling down, we have a wonderful discount network available to you here, which includes your nearby vision, physiotherapy, massage therapies, other practitioners, dental clinics, etc. And here we have a provider map, which shows the nearby hospitals, clinics, laboratories, diagnostic imaging, etc. Now we have certain extra coupons available to you from Rexall and other brands. And then last but not the least, we have the wonderful call center information. Our call center is available to you, and you can always reach out to them whenever you're looking for any assistance. You can reach out to them through email, or you can contact them on this given number. We also have a live chat option right here, and it is a real person on the other end. So you can use the live chat option as well. Okay, so we go back to sorry, my bad. I will go back to the main page. We have covered everything, all the information that I had for you today. Just few additional information for your WeConnect and your student wellness program. We have information available here as well. Then for your family opt-in, you will soon get a tab on this page, and you can do it online by going to the tab and filling the details. Then if you see here, we have a virtual doctor option. Now, virtual doctor is, you can actually seek assistance from a doctor virtually. This is recommended for any smaller ailments, for example, a upset stomach or a minor headache, or anything like that. So you can always provide, or you can always seek assistance from a doctor virtually. They'll be able to prescribe you, they'll be able to provide you a prescription if needed, and if needed, they can always recommend you to go see a doctor in person. Okay, so this is everything that I had for you today. I will stop sharing my screen so we can start taking up some questions.
Perfect. Thank you so much. So if there are questions, if I can please ask you to use the raise your hand feature. So there haven't been any questions in the chat that pertain to what you've been chatting about. So yes, if you guys have questions, please just use the raise your hand feature and we can call on you in that order.
How special it is. So
You can always put up your, oh, I see a hand raise.
You want to go ahead and ask your question?
Hi, ma'am.
Hi, Nisha.
How are you, ma'am?
I'm good. How are you doing?
I am good. Ma'am, my question is regarding ISF form. Can I ask about that?
Crystal, that is something you can help them with.
I can help you with that afterwards. So if we can
Oh,
just stick to more care type questions right now, and then
oh,
once we're past that, then I can assist you with general questions. Yeah.
okay, no problem.
Eduardo, did you have a question about more care?
Ma'am, from where we can get the health card?
So the health card, as I mentioned in the presentation, you have the, which is called the student medical card, is available to you on the website. If you go to the Your Space section on the Morcare website, you will see a student medical card section where you need to put in your date of birth and your student ID, and you'll be able to generate it. As I said, during the start of the semester, at times we are not able to, like if we haven't received the enrollment files, if it hasn't started yet, so you'll not be able to generate the card. It might take a week or two, but in any case, you're still covered. Even if you can keep your receipts and file for reimbursement, you'll be reimbursed for that. But yes, you'll be able to generate your card soon as you start with your classes and your coverage.
I mean, the physical card is available, right?
So it is on the website. So if you want to use a physical card, you feel free to download it, get it printed, however you want to use it.
Okay, okay, thank you.
Absolutely. Thank you.
Hi, good morning.
Hello.
Sorry I couldn't speak before.
No worries.
I was wondering about any pre-existing conditions because I need to continue my treatment of with a doctor, with a neuropsychologist.
Absolutely. For the pre-existing conditions, we have 90 days of with grandfathering effect, which is it should be stable for 90 days before you arrive. I would recommend reaching out to a call center for specific information that you're looking for, because they'll be able to assist you better depending upon the condition. I am not in the position to answer that as of now, but I really want to tell you that this is included, this is there in the coverage, but I would totally recommend you to reach out to the call center so you can have a more private conversation with them.
Good. So it's the phone number that it is on the website.
Absolutely, absolutely. You can email it to them, you can use the live chat option, or you can give them a call. At times there's like a hold and they're asked to wait, but in that case, they also give you an option to call back. So you can maybe use that and skip waiting in the line.
Oh, perfect. Just to know. And out of just drugs that any medication that I would have to buy with a prescription, the medications do have some sort of reimbursement from the Morcare as well?
Yes, as I mentioned, you do have prescription drugs as a part of your coverage. Under prescription drugs, if you see under your coverage, you have prescription drugs, which is available to you. It is 80% reimbursement for $5,000 maximum per student year. If you're looking for any particular medicine, particular drug, then again, I would recommend a call center for any specific information that you're looking for.
Thank you so much. Have a good day.
You too. Thank you.
Yukiko?
Yes, good morning. I'm already here in London,
Okay.
and last week I was involved in a car accident, and I had a doctor consultation, and that cost will be covered by my Japanese insurance company. But the doctor suggested me to take physiotherapy, and I'd like to take physiotherapy in September because I don't have any time now. So does Morcare cover my physiotherapy in September?
Yukiko, if you can just mention it to me, I'm so sorry for what happened. If you can just mention, when does your coverage starts?
Cover it?
Like, you're joining, like you're starting your classes in
September.
September.
Yeah.
Okay, absolutely. So starting September, you are covered with us. You have the entire coverage that I just took you through. So you will have physiotherapy as a part of your coverage as well, and you can make use of that.
Okay, thank you so much.
Of course. Just a heads up, guys. I just wanted everyone to know that refrain yourself from asking any personal information or any personal questions, because that is something that a call center would be able to help you better with. I'm here for any general information that you may require. I would try my best to help you in any way I can.
So was there any other questions? Oh. Ato?
Hello.
Hello.
I'm having a question about the early arrival part. Do we have to apply for this, or is
So early
already?
arrival, sorry.
Yeah. So do we have to apply for this, or is automatically covered for?
Sure. So your coverage is already provided to you. For any part of your coverage, you do not have to do anything to activate it. It is included in your tuition fee. It is available to you. All you need to do is start using it. And same with early arrival. So even early arrival is a part of your coverage. So if you happen to arrive 30 days prior to your effective date, prior to your start of the classes or start of the coverage, you're still covered. You have your primary coverage. You can reimburse by submitting your receipts, because you will not be able to use your card or go for direct billing, but you can still reimburse for your primary coverage by keeping your receipts and submitting them online.
Okay, thank you very much.
Absolutely.
I
Eduardo, do you have
forgot.
another question?
Yeah, I forgot to ask about family, my family, because I came here with my wife and my 3 kids. I know the option to put them in the coverage is still not available.
Yes, it will be available to you starting starting September 1st, when your coverage will be live, when your classes will start. So the information and the tab for that will be available on the website. All you need to do is
Okay.
go to the website, click on the tab, follow the steps. It comes with an extra cost. I cannot mention how much as of now, but it will come with an extra cost. So all you need to do is pay that, and you'll be able to have the coverage for your family, the same coverage as yours.
Yeah, that was my next question. It covers the same thing that it would cover from me.
Yes,
Nothing.
absolutely. It will be the same coverage as yours.
Perfect. Thank you.
Thank you.
Beulah?
Yes, I joined in late, so I want to find out where can I get the Morcare card?
So Morcare card is your student medical card, which is available to you on the website. So if you go to the website, there's a Your Space section there. When you go there, scroll down and you'll be able to see the student medical card section. All you need to do is fill in your date of birth, your student ID, and you'll be able to generate it. As mentioned earlier, it takes a week or two during the starting of the session, because we're still receiving the enrollment files, but you'll be able to generate it, and you'll still be able to reimburse with any receipts that you might have.
Okay, thank you.
Yes. I will just put the link to the website in the chat for everyone to,
I will appreciate. Thank you very much.
of course. And also, just extra piece of information, very useful. We have our representative, Mariam. She's there on campus, and she'll be able to help you. Mariam, can you take a few minutes to introduce yourself and let everyone know which side of the campus they can help find you and your timings?
Hi everyone, my name is Mariam and I am your Morcare rep at the campus. You can always come to me. I am located at J1004. It's right outside the campus clinic, so you can find me over there.
Amazing. Thank you, Mariam.
Welcome.
So if you have any questions on your, like after the session, if you still have any questions, any queries, you need help with submitting your claims or any such thing regarding insurance, Mariam is there on campus. You also have our call center details, so you can always reach out in case you have any questions after the session.
Okay, was there any last minute questions? Okay, so thank you so much both for joining us today and giving us so much information.
Of course, thank you so much, Crystal. It was lovely chatting with everyone, and I hope you all stay healthy and safe.
Okay, thank you.
Bye.
Okay, so we will start the second half of the presentations today. I'm going to be going through the offerings of our Counseling and Accessibility Services office. Unfortunately, we weren't able to have a guest speaker from that area this time, so I'm going to do my best to cover that for everybody. So let me get my screen sharing started. Thumbs up that you can see my screen. Oh, perfect. Thank you, Victor. I see a thumbs up. Perfect. So we do have our Counseling and Accessibility Services office here on campus at the Oxford Street location. They are in our F building. Now, they do also visit other campuses, so if there were need for it, there is counselors that do access the other sites as well. So wellness activities. So you can actually visit your My Fanshawe, and under student resources, there is the counseling site. They have a lot of wellness options and just different things you can practice and try to kind of help with stress, such as like meditation tools and stuff like that. They do offer lots of groups and workshops. So be well, they have presentations, there's anxiety workshops, ADHD groups, ASD groups, grief, and even gender journeys. So really, if you're experiencing anything that you're kind of not sure on how to navigate, or you just want extra support, our counseling and accessibilities team can help with that. They also offer like drop-in sessions where you can just kind of drop in and talk about whatever's on your mind. They do have a service dog who is up there. You can go in for some snuggles with him and give him some pets and stuff. So lots of options and ways to just make sure that you are doing okay while you're here. So some of the counseling service things to know is it is free. So any of the counseling, whether you're talking to them about academic issues, personal issues, disability type issues, it's all free. It's going to be confidential. So they cannot then talk to your professors about it. If you were to be given accommodations, such as like longer periods of times to do your testing and stuff, your teachers would receive forms that tell them that you need extra time, but not why. So anything that's personal about your needs stays between you and the counselor. So you can make appointments, or they also have a same-day service. This number here, the 519-452-4282, is their general phone number, and they can arrange visits for over the phone, virtual, or in person. If you are on campus and you find you're having some sort of an emergency that requires an on-the-spot chat, they also do have same-day emergency appointments. So often we do have students that will come to the international office and just say, I'm really struggling with this, and we're able to get them in to see a counselor. And I know that in some of your home countries, counseling and things like that might not be something easily accessible. But here we do want to make sure that our students have access to those resources and supports. So personal counseling. So you might want to see them for things like adjusting to a new environment, which is going to be a huge thing for all of you. You are all coming to Canada from many countries around the world, and that's going to be a big adjustment just in terms of the culture, infrastructure, in terms of housing, in terms of groceries, any of those sorts of things. Stress and anxiety. So you're coming to attend classes, which may create some stress and anxiety. You may have issues around presentations and stuff like that, and managing all the academic side, or it could be more related to your personal life as well. So they can help you with that and give you tools and techniques to reduce the levels of stress and anxiety. Relationship, gender identity, or family concerns. So sort of any concerns you have around that, you know, if your partner's back home and it's going to be a challenge, right? Because you're going to be very far apart. So counseling can help you with that. If you find that you are suffering from depression, they can kind of help you navigate that and get you resources. And addiction. So if you are battling an addiction, so that could be to drugs, to alcohol, things like shopping, all kinds of things can be an addiction. And if it's affecting your daily life, then they can help you navigate that. So it really is they'll kind of help with anything, any of your needs. So community resources that are available 24/7, 7 days a week, 365 days a year. So good to talk. So this was just a way to reach out and chat. And then there is reach out lines. And these are anything here that's a 1-800 number is toll free. So there's no cost to call it. And then the local number would be a 519 or other area code. And if you wanted some in-person supports, they do have like an emergency clinic at 648 here on street. So the idea is just that you are not alone. and whatever you're going through, we'd love to kind of help you navigate that. So accessibility services. So in 2021 to 2022, 3,500 students and apprentices registered with accessibility services. So these are going to be students that have some sort of a disability, whether it be physical, emotional, psychological, that affects their ability to perform the classroom expectations. And we are able to do early ID and assess things and help students so that they start off on the right foots, whether that's meaning that you need more time for tests, or maybe you need a quiet room for tests because there's too much noise and you get overstimulated, or maybe you can't do presentations the same way, or if you can't note take. So there's ways to have other students or supports to help you be successful as a student. And counseling and accessibility services are available at all campuses. So it doesn't matter which of our campuses you're at, you can access those resources. So some types of disability. So an acquired brain injury. So if something happened and there was an impact to your brain and its processes and its abilities, if you were on the autism spectrum disorder, so that would be for students. So maybe you just need less stimulation. Maybe you need more quiet time. So they would put things in place to make sure that your learning conditions meet that. Attention deficit disorder. So you have a hard time with paying attention to things or following the content. Chronic illness or medical issues. So things that can impact your learning. Deaf, deafened, or hard of hearing. So maybe you need a translator. So someone that can sign things. Learning disabilities, low vision or blind, psychiatric or mental health. So things like anxiety, depression, bipolar. So for any of those sorts of issues, they can also kind of help mold your classroom expectations to meet that. And then mobility and functional. So if you do require some sort of added mobility supports, they're able to do that. And then others would be things like communication. So if you think that you may have a disability or something that's going to make learning and being successful a challenge, you can connect with them, and with your doctor's notes and such, they can actually help you to get access to other resources to hopefully help make you more successful during your program. So this is showing us as a scale here, the percentages of total numbers. So this is from 2001 to 2022. And you can see sort of what the disability types were that our students got assistance with. So mental health is a big one, and that's something that in here in Canada and definitely at Fanshawe, we aim to offer supports for, because that can run the gauntlet of different type things, and it can affect anybody. Learning disabilities, others, ADHD, medical, autism spectrum, functional disabilities, acquired brain injury, blind or deaf. So as you can see, it's a variety of reasons why students might access the accessibility options there. So accommodations for students. So it's going to be based on your documents, your individual needs, and your program requirements. Okay, so, and if you don't have the documents all together, they can do an interim accommodation plan. So that's where it might only be for 2 months while they receive all your documents. So examples of some accommodations that can be given is extra time for tests and exams, a note-taking service, individual classroom accommodations, textbooks in alternate formats. So if you are low vision and you can't read the textbooks, then they can switch the formats to you so that it can be read to you, and other options like that. And specialized furniture if it's needed. So lots of ways to make sure that our students are successful. So if you think you could have a disability, or you just might want to have that assessed and possibly have some extra supports, you can register with Accessibility Services at www.fanshawec.ca/early ID. So this can be done even prior to you coming. It just lets them know, and then you can start the process well before you're here. So you would submit your documents. You would attend an orientation session, and you would meet your accessibility counselor to discuss your specific needs. Because the needs of every student are going to differ. So it is really going to be a customized plan for you. So stay connected with counseling. They are here for you. They definitely want to help support you. They are a wonderful group of people. So counseling and accessibility services, we have the general phone number, and then as well we have their email. And our website has all of this too as well. So if you weren't sure how to connect with them afterwards, you can always connect through the website as well. So I will stop my share. I know we covered a lot of information. And if you'd like, we can use the raise your hand feature to answer some questions in relation to counseling and accessibility services. Was there any questions about any of the content that I just went through?
No, ma'am, no.
No? Perfect. And it might be something that you don't think you need until you're here, right? And it's a service that you can access right once you're here. So perfect. So with that, then I will open it up for general questions. I know there was some visa questions, and I will do my best to answer those. Rupinder?
Yes, ma'am. Ma'am, I wanted to know how to apply the FAN card.
Yeah, so if you go to our website and you look under the fan card, there's actually a link there to submit your picture and your photo ID as proof that you are the person that you are applying for the card for. And then they'll receive it and they'll respond back to you once it's been approved. And then you can come in and pick up your card anytime in E2020.
Ma'am, it would be really helpful if you shared the link in the chat.
Oh, sure. I will attempt to find that on the website.
Thank you, ma'am.
Yeah, no problem. Was there any other questions while I'm looking for the link that I can help with?
ma'am, I
Yes,
have one
good
question, ma'am.
afternoon. Hi. Oh, do I go ahead? Okay, good afternoon.
Hi, good afternoon.
Sorry. Yeah, so my question is, as regards the ISF form, someone like me, I've submitted and I haven't been given a feedback yet. I just wanted to confirm what the status for accommodation is. If they say most accommodations are already occupied, that there are no vacancies as it is. So people like us who are not yet in Canada, how do we go about accommodation issues? Are there other options off campuses that would be accessible to us? And when do we get a feedback on our ISF forms to indicate that they've been acknowledged and the shuttle services will be available to us? Thank you.
So if you've requested a shuttle, then you would hear back from us usually about 7 days prior to your travel deadline with your booking.
Oh, okay. Okay.
Yeah. If you didn't request a shuttle, then you would still receive a email back just noting that you didn't ask for the shuttle, but that your shuttle has that your arrival has been approved.
Okay.
So you would still receive communication from us that has been received.
Ma'am, I have
Okay.
one question that if I wish to change my course, is it possible?
So changing your course is going to be very difficult because you have said to IRCC that you wanted to come to Canada to study a specific course, and your study permit is going to be based on that. So it can be quite difficult to change your course. But that's something that you could talk to one of our recruiters about once you're here, or if you're working with an agent in country. But it can be a challenge.
What are the procedures?
No specific procedures because it's not something that's usually done. So you would have to get special permission to change your program. And I just don't know if that's going to be an option for September yet because that's not been expressed to my team yet. So
Should I want to speak to the admission center, right?
you should follow up with your agent or recruiter.
I asked my agent that if I wish to change my course, they replied me that if I want to change my course, I should arrive in Canada and meet the admission center. Then only I can change my course.
Yeah, so you can attempt that. We just don't know whether you will be able to change your course because your study permit is going to be issued for a specific program. So we just don't know
Because
what that's going to look like.
I just want to change my course into the same level. Now I
Oh,
am
so then
enrolled
that
in.
might be possible if it's the same course, it's just a different code. You'd have to come in and speak to our recruiters after your program orientation.
Yeah, that's the main question I would like to ask you. Because I
And,
just
and
want
speak to
to,
them.
yeah, I just want to change my course into early childhood education from nutrition and food service management. Both are
So
in
those are
same level,
two
right?
different schools of study, and it may be a problem. But that's something that you are going to have to address with a recruiter once you're here.
Yeah, nutrition and
Okay.
food service management is in London campus. Also, early childhood education is also available in London campus, right?
So it's not about where the campus is located, it's in relation to the field of study. But you need to speak to them once you arrive, because I don't know enough about that to speak anymore.
Okay. Thank you.
Okay.
Thank you. Okay,
And I
thank you.
Sorry,
am
Miss
adding the link
Krista.
to
So-
my photo for the fan card. I'm just going to add it to the chat for the person that was asking about that.
Hi, Miss Crystal. Sorry,
Thank
my
you.
first
Hi.
question was not attended to. I just want to
Yes, I
confirm
realized that. Yeah.
the accommodation issue is a big issue for someone like me. I wouldn't want to be in an Airbnb for a long time. So that's why I'm asking, are there other accommodation options aside, because I have sent a request to the Fanshawe care teams as regards accommodation. And a feedback was given to me yesterday that there are no spaces available at the moment. So, and that I should source for accommodation elsewhere off campus, but I don't have an idea. And there's no group, there's nothing, nobody to put me through. So I don't have an idea how to go about it. So I don't know if there are available off campus accommodation options that we could look into to help
Yeah, there
facilitate this search.
Yeah, there is. And we use a third party group that's off of our website. It's Places for Students, and they vet places. So so anything posted there has at least been reviewed and should not be any sort of a scam. So we recommend starting with Places for Students, but we are going to have somebody here from our housing department later this week on
Okay,
Thursday.
thank you very much.
So they
Okay,
can
I'll join,
also
I'll
give
be
us
there.
more supports.
All right, thank you very much.
You're welcome. iPhone user? Oh, okay. Maybe their question was answered. Sukraj? Sukraj, did you have a question? Andrea, did you have a question?
Yeah. Can you hear me?
Yes, I can. Hi.
Yeah. So my question was regarding the lockers. I did receive an email, but I was not able to access the link. And right now I'm searching for that email and I'm not able to find it. So I'm not sure if you can help me and share like the link where I can purchase or subscribe to the lockers.
I think if you were to just go to the student's website, you should be able to request a locker there.
You mean
Let
the web advisor student, or which?
So I'm on the main student website, and parking and lockers is an option, but let me just, I'll just post the link in the chat, okay?
Okay,
Just to
thank
make it
you.
a little bit easier.
Thank you.
Okay, just taking a look here because this is looks like there's just like a bunch of steps sort of here. So I just want to make sure I get you the right link. I'm going to send you the link here on the locker info, and that should give you the ability after that to request a locker. I'm going to put that in the chat, okay?
Okay, thank you.
You are welcome. Perfect. Okay. Alvine, did you have a question?
Yes, I did. Hi.
Hi.
So I would like to ask if it's actually necessary or mandatory to do the WRIT test, because I have been getting emails about the WRIT test.
Sorry, I was not able to hear that whole question. Are you able to speak a bit louder?
Yes. Can you hear me now?
A bit better, yes.
Yes. I would like to confirm if it's actually necessary to do the WRIT test assessment or something, because I've been getting emails about that. And I already saw it on my course. So I was having a conflict of resolution if I'm supposed to do the test or the assessment.
Yeah,
Now that,
so I think you are referring to the RIT assessment.
yeah.
Yes, so the RIT assessment, it just allows the RIT team to see your level of English writing. If you were to be exceptionally well at it, then you could potentially not have a RIT course on your schedule. But most students, even domestic students, end up with the RIT course. So if you don't do the assessment, then they'll just place you in RIT level 1. So it's not going to impact anything, really. Just you wouldn't have had the opportunity to get cleared out of a RIT class. But as I said, most students end up in the RIT program anyways.
So if I happen to do the assessment, probably like, let's say, a planned date before I travel to Canada, and they get the results and the results are out, will I be exempted from the RIT test?
Potentially, it would depend on how you scored on the writing test.
Okay, I get you.
Okay, so it's just an assessment to kind of gauge where you are with your English writing.
Okay, thank you very much.
You're welcome. Hugo,
Hi, can you hear me?
I can hear you. Yes, yep.
Okay, good morning.
Good morning.
Before I got my study permit, my course was withdrawn and I was given a new course that has a co-op.
Yep.
And within that period, my study visa was approved. So I don't know if I have any issues because the former one did not have like a co-op. Yeah, but this
Okay.
new one has a co-op.
So if you arrive and your study permit doesn't have the co-op on it, our student life and immigration advisors can assist you with filing to add the co-op work permit to it.
Okay. No
Okay.
issue then.
So if you want to bring it in once you arrive, and we can check to confirm that you received a study permit and the work permit because of the co-op with it. Okay. Tukaraj?
Hello, ma'am. Good morning.
Hi.
Ma'am, my question is about ISF.
Okay, yeah.
There was a glitch in my email, and I was not receiving any emails from Fanshawe College.
Okay.
So yesterday I got it fixed, and I received all of the mails at once. And I have not yet registered in the student ID login, and my temporary password has expired. And the
Okay, so then
deadline
you
for
would,
the
yeah.
and the deadline for the international student form is 5th of August. So I was wondering if you could help me with that. I have already mailed Fanshawe International and Fanshawe Cares about the same concern, but I have not got any revert. So can you please
So,
help me with
and
that?
if it's in relation to your password and resets and stuff, we actually don't have any access to that. So I would
Okay.
recommend that you go online and connect with our IT service desk, and they should be able
Okay.
to reset any expired passwords for you.
Okay. Ma'am, can you provide me a link for the same?
So while I'm looking for that, does somebody want to ask the next question?
Okay, ma'am. Thank you so much.
Yes, I do have another question.
Yeah, perfect.
So, one of us mentioned about the locker spaces and booking a locker. Is it mandatory to do so? What's the essence of the lockers, or you can just do without?
So a locker is completely a choice. You do not have to feel like you have to have a locker. Many students don't use the lockers. It would be more for students who know that they're going to be carrying heavy books and maybe bringing a lot of equipment and stuff and would like to not have to lug that around. The locker just kind of gives you that option to have a place to set your stuff.
Thank you.
You're welcome. And I'm just going to put in the chat the link to our online tools, which will walk you through all the steps
Hello.
there. Hi,
Hello.
Muriel.
This is Aleta. I just want
Okay.
to make clear regarding my program, which is if it is still PGWP, because I'm confused that I received an email before that there's a clarification. But when I check the code, which is under my program, which is community pharmacy, is still intact. So there's no problem about that.
I wouldn't imagine so if it's still showing that way, but if you had a question about that, your best bet is going to be to contact our admissions team to make sure that
Okay.
that hasn't changed. I don't have access to that part of the system to see what all is WP aligned and any
Yes.
changes.
Yes. And anyway, I'm from time to time I'm checking the IRCC and the code is still there. And anyway, I'll just double check with the admissions office. Thank you.
Perfect. Thank you. If you did have questions that weren't answered today, Fanshawe Cares at fanshawec.ca. If you send them there, we can at least get you sent to the right person. So I just want to say thank you everyone for attending today and joining us and being so active in the conversations and everything that was happening today. And we look forward to tomorrow for day 3. We are going
Ma'am,
to
I am having one
covering.
question.
Sorry, I'm just wrapping things up today. And then if you'd like, you can join us back here tomorrow and we will cover new topics. And I look forward to seeing you all again tomorrow. Thank you, everybody.
Okay, thank
Thank you,
you.
ma'am.